In which step of the nursing process does the nurse determine the outcome of medication administration? A. Planning. B. Evaluation. C. Assessment. D. Implementation. Answer. B. Evaluation. Rational. It is systematic, ongoing, and a dynamic phase of the nursing process as related to drug therapy. It includes monitoring the fulfillment of outcomes and monitoring the patient's therapeutic response to the drug and its adverse effects and toxic effects. The planning phase prioritizes the nursing diagnoses and specifies outcomes. Assessment allows you to organize the information and place it into meaningful categories. Implementation consists of initiating and completion of specific nursing actions as defined by nursing diagnoses. The nurse plans care for a male patient who is 80 years old. The nursing diagnosis is noncompliance with a medication regimen related to living alone, as evidenced by uncontrolled blood pressure. What should the nurse do next? A. Enlist the help of a home care nurse for pharmacotherapy. B. Examine the results of nursing help with the medications. C. Collaborate with the provider on a new medication regimen. D. Assess the impact of home self-management of medications. Answer. A. Enlist the help of a home care nurse for pharmacotherapy. Rational. After establishing the nursing diagnosis, the nurse plans care by determining the nursing goals and outcome criteria. As a means of working toward blood pressure control, the nurse chooses to set up nursing assistance for the patient in the home. The home care nurse can help the patient adhere to the therapeutic regimen by making a medication schedule and dispensing medication into a pill box, among other strategies. The nurse assesses the patient before establishing the nursing diagnosis and evaluates care after implementing the plan. Collaboration on a new medication regimen is not indicated. Examining the results of nursing help with the medications is part of the evaluation process to determine if the plan was effective. Collaboration on a new medication regimen is not indicated. The nurse assesses the patient before establishing the nursing diagnosis and evaluates care after implementing the plan. A nurse is preparing to give an oral dose of drug X to treat a patient's high blood pressure. After giving the drug, the nurse finds that it reduces the blood pressure without serious harmful effects. But it also causes the patient to have nausea and a headache. Based on this information, which property of an ideal drug is this drug lacking? A. Effectiveness. B. Safety. C. Selectivity. D. Ease of administration. Answer. C. Selectivity. Rational. The drug is effective in lowering the blood pressure and safe in that it does not cause harmful effects. However, as do most drugs, it causes other effects besides the one response desired, therefore it lacks selectivity. The oral form provides ease of administration. The nurse answers a patient's call and finds the patient sitting up in bed and requesting pain medication. What will the nurse do first? A. Check the orders and give the patient the requested pain medication. B. Provide comfort measures to the patient. C. Assess the patient's pain and pain level. D. Evaluate the effectiveness of previous pain medications. Answer. C. Assess the patient's pain and pain level. The patient's medication administration record lists 2 anti-epileptic medications that are due at 0900, but the patient is in PO for a barium study. The nurse's coworker suggests giving the medications via IV because the patient is in PO. What will the nurse do? A. Give the medications PO with a small sip of water. B. Give the medications via the IV route because the patient is in PO. C. Hold the medications until after the test is completed. D. Call the healthcare provider to clarify the instructions. Answer. D. Call the healthcare provider to clarify the instructions. Which phase of the nursing process requires the nurse to establish a comprehensive baseline of data concerning a particular patient? A. Assessment. B. Planning. C. Implementation. D. Evaluation. Answer: A. Assessment. The nurse monitors the fulfillment of goals and may revise them. During which phase of nursing process? A. Assessment. B. Planning. C. Implementation. D. Evaluation. Answer: D. Evaluation. The nurse prepares and administers prescribed medications during which phase of the nursing process? A. Assessment. B. Planning. C. Implementation. D. Evaluation. Answer: C. Implementation. When developing a plan of care, which nursing action ensures the goal statement is patient-centered? A. Considering family input. B. Involving the patient. C. Developing the goal first and then sharing it with the patient. D. Including the physician. Answer: B. Involving the patient. During which phase of the nursing process does the nurse prioritize the nursing diagnosis? A. Assessment. B. Planning. C. Implementation. D. Evaluation. Answer: B. Planning. The nurse is preparing to administer morning doses of medications to a patient and has just checked the patient's name, the identification band. The patient has stated his name. Which is the nurse's next appropriate action? A. Administer the medication. B. Ask the patient's wife to verify the patient's identity. C. Ask the patient to verify his date of birth. D. Check the chart for the patient's date of birth. Answer: C. Ask the patient to verify his date of birth. The nurse is administering a medication and the order reads, give 250 mcg PO now. The tablets in the medication dispensing cabinet are in milligram strength. What is the right dose of the drug in milligrams? Answer: 0.25 milligrams rational. 1 milligram milligrams equals 1000 mcg micrograms. The nurse is administering a medication and the order reads, give 0.125 milligrams PO now. The tablets in the medication dispensing cabinet are microgram strength. What is right dose of the drug in micrograms? Answer: 125 mcg rational. 1 milligram milligrams equals 1000 mcg micrograms. The nurse is attempting to administering the morning dose of the medication. The patient refuses the medication, stating, "It makes me sick to my stomach." What is the nurse's responsibility? A. Document the patient's refusal in the record. B. Discard the medication according to hospital policy. C. Disguise the medication in food. D. Offer the medication again in 30 minutes. Answer: A. Document the patient's refusal in the record. Which medication is appropriately administered at the correct time? A. Amoxicillin ordered at 0800 and given at 0700. B. Cardizem ordered at 0900 and given at 0930. C. Furosemide ordered at 0730 and given at 0825. D. Synthroid ordered at 1000 and given at 0915. Answer: B. Cardizem ordered at 0900 and given at 0930. The day shift charge nurse is making rounds. A patient tells the nurse that the night shift nurse never gave him his medication, which was due at 2100. What will the nurse do first to determine whether the medication was given? A. Call the night nurse at home. B. Check the medication administration record. C. Call the pharmacy. D. Review the nurse's notes. Answer: B. Check the medication administration record. A nurse makes an error when administering medications to a patient. Which action by the nurse requires the supervising nurse to intervene? The nurse A. completes an incident report. B. informs the prescriber of the error. C. documents adverse effects to the medication error. D. records completion of an incident report in the medical chart. Answer: D. records completion of an incident report in the medical chart. Why is it important for drugs to have ease of administration? A. fewer medication errors. B. less risk of side effects. C. greater chemical stability. D. greater likelihood of reversibility. Answer: A. fewer medication errors. Rational. Ease of administration increases convenience and adherence and can reduce administration errors. Ease of administration is not related to side effects, chemical stability, or reversibility. When studying the impact a drug has on the body, the nurse is reviewing what? A. the drug's pharmacokinetics. B. the drug's selectivity. C. the drug's pharmacodynamics. D. the drug's predictability. Answer: C. the drug's pharmacodynamics. Rational. Pharmacodynamics can be thought of as the impact of drugs on the body. Pharmacokinetics describes the movement of drugs through the body. Selectivity is the ability of a drug to elicit only the response for which it is given. Predictability is the degree of certainty about how a patient will respond to a certain drug. When studying the effects of drugs in humans, the nurse is learning about what? A. pharmacology. B. clinical pharmacology. C. therapeutics. D. effectiveness. Answer: B. clinical pharmacology. Rational. Clinical pharmacology is the study of the effects of drugs in humans. Pharmacology can be defined as the study of drugs and their interactions with living systems. Therapeutics, also known as pharmacotherapeutics, is the use of drugs to diagnose, prevent, or treat disease or to prevent pregnancy. The term effectiveness indicates that the drug elicits the intended response or responses. Which statement by a new nurse indicates that further study is indicated? Effectiveness is the most important property a drug can have. B. there is no such thing as a safe drug. C. drugs are defined as illegal substances. D. there is no such thing as a selective drug. All medications cause side effects. Answer: C. drugs are defined as illegal substances. Rational. A drug is any chemical that can affect living processes. All the other statements are correct. What is the ultimate concern for the nurse when administering a drug? A. intensity of the response. B. dosage. C. route of administration. D. timing of administration. Answer: intensity of the response. Rational. The ultimate concern for the nurse when administering a drug is the intensity of the response, which is determined by the dosage size, route of administration, and timing of administration. The nurse teaches a patient not to consume alcohol with nitroglycerine because the blood pressure often drops significantly when nitroglycerine is taken with alcohol. Which drug property does this illustrate? A. chemical instability. B. drug interaction. C. reversible action. D. drug selectivity. Answer: B. drug interaction. Rational. When two or more drugs are taken together, they can interact, causing either increased or decreased drug responses. In this case, alcohol would increase the nitroglycerin response. Chemical instability, reversible action, and drug selectivity are not related to this situation. The nurse is preparing to give a drug with certain properties. Which property of the drug is the most compelling indication that it should not be given? A. The drug produces an unwanted side effect. B. The drug is difficult to administer. C. The drug's effects are reversible. D. The drug is not effective for its intended purpose. Answer D. The drug is not effective for its intended purpose. Rational. If a drug is not effective, there is no justification for giving it. Some drugs may be given even though they produce unwanted side effects or are difficult to administer. Reversible action is a desired property for most drugs. An 86-year-old patient is being discharged to home on digitalis therapy and has very little information regarding the medications. Which statement best reflects a realistic outcome of patient teaching activities? A. The patient and patient's daughter will state the proper way to take the drug. B. The nurse will provide teaching about the drug's adverse effects. C. The patient will state all the symptoms of digitalis toxicity. D. The patient will call the prescriber if adverse effects occur. Answer A. The patient and patient's daughter will state the proper way to take the drug. A patient has a new prescription for a blood pressure medication that may cause him to feel dizzy during the first few days of therapy. Which is the best nursing diagnosis for this situation? A. Activity intolerance. B. Risk for injury. C. Disturbed body image. D. Self-care deficit. Answer B. Risk for injury. A patient's chart includes an order that reads as follows. Atenolol 25 milligrams once daily at 0900. Which action by the nurse is correct? A. The nurse gives the drug via the transdermal route. B. The nurse gives the drug orally. C. The nurse gives the drug intravenously. D. The nurse contacts the prescriber to clarify the dosage route. Answer D. The nurse contacts the prescriber to clarify the dosage route. The nurse is compiling a drug history for a patient. Which question from the nurse will obtain the most information from the patient? A. Do you depend on sleeping pills to get to sleep? B. Do you have a family history of heart disease? C. When you have pain, what do you do to relieve it? D. What childhood diseases did you have? Answer C. When you have pain, what do you do to relieve it? A 77-year-old man who has been diagnosed with an upper respiratory tract infection tells the nurse that he is allergic to penicillin. Which is the most appropriate response by the nurse? Many people are allergic to penicillin. B. This allergy is not of major concern because the drug is given so often. C. What type of reaction did you have when you took penicillin? D. Drug allergies don't usually occur in older individuals due to built-up resistance to allergic reactions. Answer C. What type of reaction did you have when you took penicillin? The nurse is reviewing new medication orders that have been written for a newly admitted patient. The nurse will need to clarify which orders. Select all that apply. A. Metformin, glucophage 1000 mg PO twice a day. B. Sitagliptin, Januvia 50 mg daily. C. Simvastatin, Zocor 20 mg PO every evening. D. Irbesartan, Avapro 300 mg PO once a day. E. Digitalis as needed for constipation. Answer B. Sitagliptin, Januvia 50 mg daily. E. Digitalis as needed for constipation. The nurse is reviewing data collected from a medication history. Which of these data are considered objective data? Select all that apply. A. White blood cell count 22,000 mm. B. Blood pressure 150/94ths of a millimeter. HGC. Patient rates pain as an 8 on a 10-point scale. D. Patient's wife reports that the patient has been very sleepy during the day. E. Patient's weight in 68 kilograms. Answer: A. White blood cell count 22,000 millimeters. B. Blood pressure 150/94 of a millimeter. Hg. Patient's weight in 68 kilograms. Which statement is an example of objective data? Select all that apply. A. The patient states that she has a headache. B. The patient has clear urine. C. The patient says that she feels like someone is touching her arm. D. The patient has had a fever for 5 days. E. The patient says that she has felt tired for almost a week. Answer: B. The patient has clear urine. Correct. D. The patient has had a fever for 5 days. Rational, objective data may be defined as any information gathered through the senses or that is seen, heard, felt, or smelled. Objective data may also be obtained from a nursing physical assessment, nursing history, past and present medical history, results of laboratory tests, diagnostic studies, or procedures, measurement of vital signs, weight and height, and medication profile. Subjective data include information shared through spoken word by any reliable source, such as the patient, spouse, family member, significant other, or caregiver. What things should the nurse check when reviewing a prescription with a patient? Select all that apply. A. The patient's home address. B. The route of administration. C. The age of the patient. D. The signature of the prescriber. E. The patient's emergency contact. Answer: B. The route of administration. D. The signature of the prescriber. Rational, after assessment of the patient and the drug has been completed, the specific prescription or medication order from any prescriber must be checked for the following 7 elements. 1. Patient's name. 2. Date the drug order was written. 3. Name of drugs. 4. Drug dosage amount. 5. Drug dosage frequency. 6. Route of administration. And 7. Prescriber's signature. What information should the nurse chart when documenting medication administration? Select all that apply. A. The time of administration. B. Information about an incident report in the patient's chart. C. The patient's age. D. The route of administration. E. The dosage of medication administered. Answer: A. The time of administration. D. The route of administration. E. The dosage of medication administered. Rational. Documentation of administration is one of the 9 rights of patient medication administration and should include patient response, teaching related to the medication, if the medication is not given, refusal of medication, and reason for refusal. Medication errors should be noted in an incident report but should not be documented as an incident report in the patient's chart. Information about incident report is never placed in the patient's chart but is sent to risk management. The patient's age is already a part of the patient's record and is not needed in the documentation of administration. The nurse includes which information as part of a complete medication profile? Select all that apply. A. Use of stress drugs. B. Current laboratory work. C. History of surgeries. D. Use of alcohol. E. Use of herbal products. F. Family history. Answer: A. Use of stress drugs. D. Use of alcohol. E. Use of herbal products.